I remember hitting the buzzer on the elevator and thought, man, is this it? Like, is this the sign? Am I losing my memory? Do I maybe have like some sort of early dementia?
Welcome to Your Body, the healthcast that takes a deep dive inside your health. No matter what kind of health issue you're experiencing, whether it's the common cold, a bad case of eczema, heart disease, or breast cancer, it affects you in every way, physically, mentally, emotionally, and internally. This podcast seeks to understand what is going on with our bodies from the inside out, from our heads to our toes, and everything else in between. We're going to look at health issues from every angle and hopefully get a better understanding of what's going on with our bodies and how we can better take care of them. I'm your host, Stephanie Landon, editorial manager at RadNet, a leader in outpatient imaging services and an advocate of patient empowerment for over 35 years. We're talking about the brain, how it works, how it's organized, how can we keep it healthy, and what kinds of things can go wrong. There is so much to cover on this topic that we've made it a 2-episode special, Your Amazing Brain. Your brain is this intricate, complex organ that controls all of your body's functions. It's the source of every quality that defines your very humanity. It's the most complex part of the human body, and in some ways, it's still the most unknown. And for that reason, it can also be a little frightening. I know for me personally, I've always felt this way. I'm going to share something personal here. When I was 15, I had a friend who died very suddenly because an aneurysm in his brain had burst. It was something he didn't even know he had. And I think that this left me feeling like the brain is so mysterious and so fragile, like something unexpected could happen in there when you least expect it, and that would be that. So when I started doing research for this topic, the question I kept coming back to is, just how resilient is the brain?
I have no memory of how I got in my shorts or T-shirt. I don't know what I've done today. I don't remember how this started. I remember hearing the song, Everybody Wants to Rule the World. At this moment, I am not sure of a lot of things. And then I write in bold letters, I don't remember writing any of the above.
This may not be how you're used to hearing Jeff Probst. You probably know him better as the confident, commanding, sometimes cheeky host of the CBS reality show Survivor. Jeff has won Emmy Awards, he's traveled the world, written a bunch of books, directed a couple of movies, but it was 3 hours with an episode of what is known as Transient global amnesia that really gave him a new perspective.
This was, I guess, almost 3 years now.
Oh. Okay.
Yeah. And what happened, what happened was I was making reservations, airplane reservations, and I was making them for my wife, and it got to the point where it asked you birth date.
Right.
And I was confused of which day was her birthday and which day was our daughter's birthday, which I thought was a little odd because I know them. I know what those dates are.
Right.
And then I saw a year next to it, and I thought, I have no idea what year she was born. And so I immediately called Lisa, who was at work, my wife, and she said, what's going on? And I said, I don't know. And she said, what do you mean? I said, I don't know. I don't know what's happening. I don't know how I got my shorts or my T-shirt on. And she said, what are you talking about? And I said, I don't know. And she goes, all right, I'm coming home.
Yeah.
And she said, call my best buddy. His name is Lopez. She said, call Lopez and just tell him that he needs to stay on the phone with you until I get there. So I call Lopez and I say, hey, I'm not really sure what's happening, but my wife said I'm supposed to call you and that you're supposed to stay on the phone with me. I don't know why. And he said, okay. And so we just sat there. And while we sat there, I said, I'm going to write some things down, which I have no memory of doing this. But this is what I wrote down. 4-hour records of me right now. I have no memory of how I got in my shorts or T-shirt. I don't know what I've done today. I don't remember how this started. I remember hearing the song Everybody Wants to Rule the World. At this moment, I am not sure of a lot of things. I am not sure where Michael and Ava are, if they are in school. It feels like it's summertime, so they should be home from school. Then there's 2 big spaces on the document, and it says, this feels like it just happened, but I do not know what I did this morning. I have no memory of saying how tired I am. And then I write in bold letters, I don't remember writing any of the above.
That's nuts.
So in that moment, I was able to write things, and then within seconds, I looked down and went, I have no memory that I wrote that. So that was the first phase.
Yeah.
Do you want me to keep going?
Yes, please. That's scary.
Yeah, I was unnerved.
Were you scared in that moment?
You know, it's funny you say scared. I was really confused.
Mm-hmm.
I don't think I was aware enough to be scared. I
Right.
just didn't understand what was happening.
Right.
And my buddy stayed on the phone with me the whole time.
Yeah.
And then my wife got home, and
Yeah.
she said, let's call your doctor,
Yeah.
Dr. Horowitz. And she said what was so weird was you knew his number by heart. You spat it out to me and said, oh, this is his number. But you couldn't remember anything else, but you remembered that number. Then I guess I talked to him on the phone for 20 minutes. I have zero recollection of talking to him. And then he said, okay, you guys need to come see me right now.
Yeah.
So as we drove to see him, Lisa said, you kept telling the same story over and over as though it was the first time you were telling me. And I kept listening like it was the first time I was hearing it. And then you would tell me again. And I have no memory. You just told me that story. So we get to Horowitz's office, and he gives me a stroke test.
Right. That's what I was going to ask, if he thought you were having a stroke. Yeah.
Yeah. So he had me count backwards from 100 in 7, and I passed, which I was pretty proud of. and then he said, it's possible you could have had like a small blood clot that maybe passed through your brain for a moment. But he was kind of dumbfounded. He wasn't sure what it was. So he set up an MRI, and we left there, and we drove immediately to get the MRI. And as we're driving over there, this has now been probably 3 hours total.
Wow.
My memory came back clear as day.
Just all of a sudden, like a light switch.
All of a sudden. So much so that I said, I'm back. And Lisa said, no, you're not. And I said, no, I'm fully back. So much so that you can drop me and I'll take an Uber home. She goes, no. I said, no, babe, I'm telling you, I'm 100%. I don't know what happened, but I'm 100%. So she dropped me off.
She was like, okay.
Well, I did persuade her. I mean, I think she asked me a bunch of questions.
Right.
But then the reality started to set in, and I remember hitting the buzzer on the elevator.
Yeah.
And thought, man, is this it? Like, is this the sign? Am I losing my memory? Do I maybe have like some sort of early dementia?
Right.
And then we go into the MRI, and the woman was so cool and so nice to me and so comforting.
Yeah.
And she goes, do you want to hear some music? And I said, yeah, sure. She goes, what do you want to hear? And I said, I don't know. Really, I don't really care, whatever you like. She puts on Dave Matthews Band, and the song was You and Me, which is the song that my wife and I got married to.
Weird.
And I'm lying on the MRI bed going, oh my God, this is how it goes in the movie. Right before he dies,
oh my
he
God,
hears the song. I thought, this is too crazy. She chose the song. It's not just a band I know. It's the song I got married to. And so I'm sitting there going, oh my gosh, this is it. Like, my life is changing. So then I go home. Next morning, my doctor was able to get me a very early appointment with a neurosurgeon who came in at 5:30 to see me. We sat down, We went in his office. We sat down. He asked me a few questions. He said, how long was your memory gone? I said, like 3 hours. And he goes, and what do you remember from that time? And I said, absolutely nothing. He said, all right, now we're just going to talk for a bit. So we talked just about life, and he asked me who I was and what I did and all these things. Yeah. And after an hour, he said, okay, I know what it is. It's TGA, total global amnesia. And then he explained to me that nobody's really sure where it comes from. It's not indicative of anything. It's not related to a stroke. The chances of you having it again, while it could happen, are not likely. And you don't have to worry. There's nothing wrong with you. You just, for a moment, couldn't remember what was happening. Yeah.
Yeah. It's crazy, though, that happens.
It was one of the weirdest things ever in my life. And definitely, even though I feel completely fine and I'm not worried about anything, it was one of those almost gifts, because that elevator moment where I was waiting for the elevator to open and thinking, what if this is the beginning of the end?
Yeah.
Because I didn't know.
Right.
I just knew something super bizarre had happened, and I couldn't even remember things like where my kids were.
Yeah. Yeah.
And so maybe that's what it was just that, I think that's the way I've chosen to look at it, as it was a great little gift that's how fast your life could change. Suddenly you can't remember anything.
It's interesting, though, also that they didn't just have you call 911, when they called the doctor. Or
didn't even occur to me.
Rush you right to a hospital if they all thought it was a stroke.
That's a really interesting thing. I know Horowitz was talking to my wife for a while.
Right.
So he was probably asking her questions like, along that line, like, how is he right now? Because I was just as normal as could be, other than I had no idea who I was.
Yeah. Yeah. This is one of those brain things that sounds completely bananas. You could just lose your memory for no reason. According to the Mayo Clinic, transient global amnesia is defined as a sudden, temporary episode of memory loss that can't be attributed to a more common neurological condition, such as epilepsy or stroke. During an episode of transient global amnesia, your recall of recent events simply vanishes, so you can't remember where you are or how you got there. I'll get back to Jeff in a minute, but first, I wanted a little more insight into this.
Transient global amnesia is the sudden loss of memory, and it manifests as a temporary inability to form new memories and also to recall the recent past events. So although there's memory loss, the person retains a sense of personal identity, so they know who they are, and they also retain normal cognition, meaning that they know who they are, they can recognize and name familiar objects and follow simple directions, but they've lost their memory. So often they'll say things like, where am I, or how do I get here?
This is Dr. Suzie Bash. She's the medical director of Neuroradiology at San Fernando Valley Interventional Radiology in Los Angeles. She is a board-certified neuroradiologist and is actively involved in clinical trials concerning artificial intelligence applications in neuroimaging.
The duration of memory loss is no more than 24 hours by definition, although it's typically only 1 to 2 hours. And then there's gradual return to memory. And it typically happens in people over the age of 50, although there's variability. And it typically only happens 1 to 2 times in a person's life, and then usually never happens again. So often only once and sometimes twice, but usually almost never more than that. So it's not a life-threatening condition, but it's very scary if you're the person experiencing that. And so the cause of transient global amnesia is unknown, but there is a link between transient global amnesia and migraines. So most people, migraines are very common. Most people with migraines are never going to experience this. But if you do have migraines, your risk for transient global amnesia is significantly higher than the general population. And so this is really a diagnosis of exclusion, meaning other known causes of sudden onset memory loss must first be excluded. So you have to exclude stroke or seizure. You have to make sure there was no alcohol or drugs on board, and you have to make sure that there was no recent head trauma. Now, a lot of these things you can actually sort of tell over the phone, which may have been the case. I don't know the details of this case that you're mentioning, but But if there's no weakness on one side of the body and no other neurologic symptoms other than just memory loss, it's unlikely that it's probably going to be a stroke, although
Right.
I would encourage anyone to always get checked out, obviously.
Yeah.
And then also seizures are usually, there's other signs, telltale signs of seizures, often shaking and things like that. But you do need to exclude those because those things can incorporate memory loss. And so the very interesting point is people with transient global amnesia are not at increased risk for stroke or seizures. And so there's no treatment necessary for transient global amnesia since it's really an isolated event.
Now that we understand this weird neurological quirk a little better, let's get back to Jeff.
I definitely worry about brain health and getting
Sure.
enough sleep and, eating less. I guess those are the two things I have learned so far is just sleep and don't eat as much and you'll be healthier.
And you didn't experience anything leading up to it?
Nothing. And that is the weirdest part, Stephanie, is I still can remember vividly being in the kitchen. My job was to get us reservations somewhere, and
Yeah.
it got to date, and it was, it's May. Is it, which day? It's Ava's this, and she's that. And then I look across at year and go, no idea. Not even a clue what year my wife was born.
Right.
And
that's
then I
when it
picked
just
up the
dropped
phone.
off. Yeah.
Yeah. And to my wife's credit,
Mm-hmm.
she said, I said, what's up? She was at work, and she said, you said, I don't know. And I said, what do you mean? He said, I don't know. I don't know what's going on. And immediately she said, I'm heading home, call Lopez. Like there was something in the way I was talking
Yeah.
or something intuition that she picked up on, which is, I don't know what's happening, but I'm leaving immediately.
Right. Right. Yeah, I'm just
Thank God,
looking
otherwise I'd still be wandering around.
Well, for 3 hours you would have been.
Yeah, good point, yeah. I think my wife was pretty smart.
Yeah.
Thing, and I have to also say that the fact that I have a doctor that picked up the phone immediately.
Yeah.
And I remember we called the office, and I do have a good relationship with him, but I remember Lisa said, something's happening to Jeff, and I need to talk to the doctor right now. And she said he got on the phone immediately and was like, what is it? She said, I don't know. He's lost his memory. And so I was really fortunate that I had that access.
I think we all have to be educated not only for ourselves, but to be able to recognize things in our loved ones.
Yeah. Yeah. And have a thing in your phone that says in case of emergency.
Yeah.
I didn't really know about that. I think maybe it was this incident where if you are in trouble and somebody picks up your phone,
Yeah.
I don't know, how would they ever get in your phone? I don't know.
Yeah.
I try to imagine situations, somebody finds me and I'm sitting with my phone or something like that. What can I do to get, so that somebody can help me help myself?
I walked over to him in a deep sweat and I said, something's very wrong and I need some help.
This is Michael Krompf. When he was 39, he had a mini stroke, or what doctors call a TIA, a transient ischemic attack. This occurs when part of the brain experiences a temporary lack of blood flow, and it causes stroke-like symptoms that resolve within 24 hours. Mini strokes don't cause permanent disabilities, but since the symptoms of a mini stroke and a regular stroke are nearly identical, you should seek immediate emergency attention if you experience any symptoms whatsoever.
It was actually, they call it a mini stroke. It was a TIA, which is a transient ischemic attack. Mm-hmm. And it's weird because it kind of snuck up on me. So it was just a very, very normal day where I got home and, worked out. We have a bike at home, so I was working out. And after the workout, we were headed on a trip the next day. So I packed some bags while I was cooling down and took a shower. And ironically, I'm usually home earlier than my husband, who's home later than I am. That day, I lucked out that he was home before me. Yeah. So after that, I don't remember a lot, but I will tell you from what he says is I walked over to him in a deep sweat and I said, something's very wrong and I need some help. Mm-hmm. And I ended up sitting down on the side of the bed, and he sat down next to me and was asking me some questions. And I knew who I was, where I was, who he was, but I looked down and saw the bags that I had just packed, and I asked him why he had packed bags and where he was going. Mm-hmm. So he reminded me that I had packed those bags and we were headed on a trip tomorrow. And then I asked him I was looking at my calendar to try to figure out what day it was and who I had had lunch with that day. So I started asking questions about that. And he reminded me that that plan on my calendar had gotten canceled. And apparently immediately after that, I looked down at the bags again and asked him, who packed those bags? Where are you going? And this series, I guess, continued about 4 times with me asking the same questions over again and just massive confusion. So he kind of went into the mode, you know, he's not a doctor by any means, but he knows enough to have me lift my arms and smile to see if there were any severe signs of stroke. And there wasn't. And he put me in the car immediately and said, we're going to go to the hospital. So that's how that all kind of came about. And then we went to the hospital. Yeah.
Thank God he was smart enough. You know, he had the wherewithal to do that.
And thank God he was there, because I do feel if he wasn't, my inclination probably would have been to lay down and take a nap.
Yeah. So what happened when you got to the hospital?
So I went to the hospital. I do remember bits and pieces at this point, but I was sitting in the waiting room. He told me to take a seat, and he ran up to the counter to tell them what was going on. And, you know, you're at a major hospital, so you expect in many cases to be waiting for hours to get called on. And all of a sudden, there were 2 individuals running towards me. They put me into a wheelchair, and they started screaming, we have a possible code brain, because they were preparing as if I was having a stroke or had a stroke.
Yeah.
So at that point, it was immediate CAT scans. I mean, every kind of test you can ever imagine. And they realized there was no brain hemorrhage or bleeding, so things started to calm down, but they did admit me. So, I mean, it followed with a couple of days of tests where they were testing everything. And the long story short was that they identified a small hole in my heart that they said I was probably born with, and that most likely it was a blood clot that got lodged into that hole in the heart, temporarily stopping the flow of blood to my brain. So that's what ended up causing the whole thing. So in terms of long term, they said I just need to take a baby aspirin, things that people would do normally, but they said the risk is very low of anything like that happening again. But it does leave long-term effects in terms of just the scare factor. So if various things happen, there have been a few different things that have happened that are, you know, just things like getting lightheaded after working out or doing things where I'm sitting there to myself saying, oh my God, is this happening again? Yeah. So, you know, there definitely is a little bit of a fear factor from there. For me, the follow-up is pretty minimal. I followed up with a neurologist for 2 years afterwards on the 1-year anniversary and the 2-year anniversary, and everything was fine. And they even said, you know, there's really no reason to be concerned or follow up from this. But, you know, it's still going through the experience, it can be pretty traumatic, and less so for me and the person that's tending to you, because the disorientation and the just lack of awareness at the time is really, really scary.
Yeah, for sure. Are you still taking baby aspirin?
Yep, taking a baby aspirin every morning. So, and that seems to do the trick. So, you know, in terms, again, long term, I don't anticipate anything like this would happen again. You know your body. So if things don't feel right, make sure that you're not ignoring those things.
Brain injury can result from several things like a stroke, trauma, infection, tumors, inflammatory conditions, surgery, or neurodementia syndromes, such as Alzheimer's disease.
Back to Dr. Suzie Bash. It's interesting that she makes the point that things like stroke and dementia or Alzheimer's qualify as brain injury.
Some neurologic symptoms are really only temporary, things like migraine headaches or seizures or transient global amnesia, TIAs, and concussions. So these are temporary insults to the brain that may not result in actual brain cell death. So maybe, for example, let's talk about 2 of the most common severe neurologic conditions which can cause sort of significant disability and even death. So let's start with stroke. A stroke is a sudden loss of blood flow to the brain. Now, 90% of strokes are ischemic due to a blood clot, and 10% are hemorrhagic due to a brain bleed. Strokes occur about every 40 seconds in the U.S. And you heard me mention TIA. A transient ischemic attack, or TIA, sometimes referred to as a mini stroke, is a temporary blockage that can cause stroke-like symptoms, but then blood flow is recovered before the neuron actually dies. However, a true stroke results in permanent death of that neuron, and those neurons will never grow back. So stroke is sort of the 5th leading cause of death in the United States and the 2nd leading cause of death worldwide, and it's the number 1 cause of disability. And so strokes typically happen suddenly and involve one side of the body. So a good way to remember what stroke symptoms are would be to use the mnemonic, be fast. So the B stands for sudden onset balance difficulties. The E for sudden onset visual changes, eye. The F is for face, so facial drooping or weakness. The A stands for arm, so arm weakness. The S stands for speech, so difficulty with your speech. And the T is for time. That's a reminder of how important time is. For every 1 minute we go without blood flow to our brain, 1.9 million brain cells die. So it's critically important to call 911 immediately if you develop symptoms of a stroke so that you can be treated and those brain cells can be saved. And we actually have wonderful treatments for stroke these days.
Wow.
And then another major thing, that we could maybe talk about would be Alzheimer's disease. So this is a neurodegenerative disorder that initially manifests as memory loss and eventually impacts all activities of daily living. So after the age of 65, the risk of Alzheimer's doubles every 5 years. Alzheimer's disease is characterized by brain volume loss, particularly in the area of the brain called the hippocampi. Now, at RadNet, where I work, we offer the latest state-of-the-art neuroimaging studies that can help identify patients who are, potentially developing Alzheimer's disease. And although there's no cure yet, early intervention is very important both for the patient and for their loved ones. So, for example, like one of our imaging studies is called an amyloid PET. And this study can identify Alzheimer's disease up to 20 years before the patient becomes symptomatic. We also offer specific dementia artificial intelligence MRI study tools like NeuroQuant or IcoBrain, and they can improve sort of the accurate diagnosis and also track disease progression over time by precisely measuring the brain volume loss in the areas that are most affected by Alzheimer's disease, like we mentioned in the hippocampus. In the hippocampus. And so there are many other things that can go wrong with our brains, especially as we age. But the good news is our technology for imaging the brain and our understanding of brain injury and even our treatments of neurologic conditions are really improving every day.
We started to see little things happening, like where she would, after coming home from errands, she lived alone at that time because my dad passed when I was 18. But she would leave the door open and leave her purse on top of the car, stuff like that, where I would literally come and meet her for lunch and I'd pull into the driveway and see her purse sitting on top of her car. And I was like, Mom.
This is my friend Megan Gefsky, and while we've talked about her mother's current state, we had never actually spoken about how she got there. That is, the story of her slow decline into severe Alzheimer's disease. Both of Megan's mom's parents died of Alzheimer's, so it does seem like it was in the genetic cards for her. But Megan and her family believe that after a diagnosis of terminal lung cancer in 2008 and the subsequent rounds of chemo, several grueling rounds of chemotherapy, that was the trauma that actually activated her cognitive decline.
Additionally, when we kind of just were over at her house, we started to see that she had started drinking more, and she was hiding wine bottles in her closet because I think she was ashamed, and I think she knew that her memory was not great. So we had a long conversation with her about it.
Yeah.
And we decided, let's go talk to a neurologist.
And do you think she was drinking because she was trying to cope with what was happening with her?
100% yes.
Yeah.
Because she also at that time didn't have a partner to kind of go hey, honey, can you pick up the slack for me? Or is this going on? Or I think there's it's nice to have that support from a partner versus your kids. It's a different relationship with your kids. You don't want to worry your kids.
Right.
She was very much that person. I don't want to worry my kids.
That generation, I think overall is like that.
100% yes.
Yeah.
So we sat down, as a family and kind of decided, let's just go talk to a neurologist and see what they have to say. So the first neurologist that we saw, so this was probably in 2009. Yeah, I would say.
Okay.
He immediately, it was very interesting. What they do is a series of cognitive exams, sort of. And then they also do a scan. What is it, an MRI? Yeah, they do an MRI. And they scanned and they said, yes, we definitely see some deterioration that's above and beyond what is normal at that age.
Okay.
In terms of the gray matter on the brain. So that has something to do with a decline in cognition, has to do with the gray matter on the brain or the plaques. So they did at that point see that there was sort of a accelerated version of aging going on, especially in the prefrontal cortex. So that's executive functioning.
Okay.
So that was interesting. And we were like, oh, well, that makes a lot of sense because she was, you know, besides like forgetting where you put your keys, like, you know, she was forgetting really, really major stuff, like locking the door and how do I lock the door? And it was just it was some strange stuff.
Yeah.
So that particular, based on all of the cognitive exams and the scans, that particular neurologist was like, she has Alzheimer's. And by the way, when you get an Alzheimer's diagnosis in the state of California, not all states are like this. I think most of them are, though. They take away your driver's license. Oh. So we had to make sure that we took away her car keys. She could not get behind a wheel at that point.
Yeah.
So we were like, and that was like the end, literally for her, sort of for her feeling of autonomy and self-worth. It went right down the drain because she just felt terrible and she had no. Yes.
Yeah.
So we were like, we got to advocate for her. And you know what? Again, it's like any good medical advice, get a second opinion.
Yeah.
So we decided to go to a different neurologist. And I love this neurologist at Cedars-Sinai Medical Center. He's amazing. Hart Cohen.
Okay.
He's still there because we just referred another family friend to him. I just adore him. He gave a whole different take on our mom. So he ran the same cognitive exams, scanned her again. Everything was sort of status quo. This was probably like almost a year later. We saw him. Okay. And he said, this is interesting. He said, your mom has something called MCI, mild cognitive impairment. Okay. And we're like, oh, this is different. We had gotten her into a condo and we were noticing that she needed a lot more help. She needed almost help with like, how do I go to the bathroom? And, you know, she was having accidents and stuff like that.
Yeah.
So we had full-time live-in care at her apartment at that point. But then we me and my sister scratched our heads again and said, you know, we have to get her into assisted living. And she had always said to us, you know, she wanted to go to motion picture and she had paid her dues for all those years as an actress. And that was where she wanted to go. And thankfully, that's one of the top campuses, you know, in the LA area. It's so great.
Yeah.
And so we were able to get her into the assisted living portion when she was still more cognizant. And I'm trying to think how many years ago. It's been like 5, maybe 6 years, 7 years. That she was in the assisted living and she just moved over to Harry's Haven, which is the Alzheimer's like specific skilled nursing care facility for Alzheimer's. It's state of the art.
Right.
She's been there for a little over almost like 2 years. And this is what I love about the philosophy of this place. It gives them a sense of freedom because they can kind of wander around. It's sort of like what I describe as like a preschool for the cognitively impaired because they have all these stations set up where like our mom likes to keep her hands busy. So like they have like almost like a laundry facility where she can walk up and like they have fresh towels and she could just fold them for hours. Oh. She likes to fold laundry.
Right.
They have a thing that looks like an office with a typewriter. You can sit down, an old typewriter. Right. You can sit down and type out letters. They have, you know, I literally, I'm so grateful she's there because she's so safe and it's so state of the art, but it also is not, it gives them a sense of respect. Yeah. You know, they can kind of just be whatever they are together. And wander around. So it's been great. It really has been great.
Yeah.
Listen, here's my biggest piece of advice and takeaway for anybody that's starting to deal with this is get a second opinion. Yeah. It's very, very important. But also get yourself help. If you don't have a sibling or a partner or a friend, it's really taxing because you're basically grieving in real time. You're grieving the loss of the person and the personality of that person that you knew, but they're physically still here. So it's a very strange transition and it's a strange grieving process. Yeah. So I tell people, please go find help wherever you can. And there's free support groups. It's a hard thing to for people that haven't been through it to understand the grieving process. It's really hard.
Yeah.
It's a really sad thing to watch.
Hi there.
Hello. How are you?
I'm good. How are you?
I am fine. Thank you. I called another friend of mine. Wendy Salzberg is a geriatric care manager. Her company provides services to older adults and their families. Things like assessments and treatment plans, counseling, coordinating caregivers or medical appointments. They help move patients into assisted living or from hospitals into nursing facilities. Basically, it's like a concierge service that helps with anything a family needs for their loved one. She's been in the geriatric care business for a long time, and she's a really good source. What is the difference between Alzheimer's and dementia?
That's an excellent question.
Thank you.
So dementia is a general term for a decline in mental abilities that are severe enough to interfere with daily life.
Yeah.
I kind of look at the word dementia like the word fruit. It's a category. So a mango is not the same thing as a banana. Neither are the different types of dementias. Alzheimer's is the most common type of dementia. It affects 70% of people that have dementia. There's also frontal temporal dementia, vascular dementia, Lewy bodies dementia, and those are the disease that is actually causing the dementia.
Got it.
What you want to find out is what is the root or the cause of your dementia and the decline in your normal mental ability.
Right. Okay. Got it. That's interesting. So once a family is dealing with that, what are the kinds of things that they can do to help them?
So let me reframe that.
Yeah.
I think one of the most important steps that people miss is they think, oh, my loved one has some kind of dementia. What we recommend is they go have a Neuropsych Evaluation by a doctor, which is a comprehensive exam that does everything from a battery of cognitive tests to lab work to brain scans. It's an overall test where they can actually determine what type of dementia you have. Once you know what type of dementia you're dealing with, you can understand the behaviors that the person is exhibiting.
Oh,
So
interesting. So there are different behaviors specific to the different types of dementia?
Exactly. And everyone that has Alzheimer's or another type of dementia is going to act differently. There's no cookie cutter behavior that you're going to get from someone. But there are classic signs. A lot of confusion about locations, moving slower, personality and mood changes. And once you understand the disease, you can relate to your loved one in a different way. I think the key to dementia is understanding the disease and trying to understand the behaviors so you don't end up locked in a cycle with your loved one that's constantly arguing with you. Information and education is key to the disease.
Yeah. As with most things.
And again, every situation is different. Every family is different. So we don't have a one-size-fits-all approach. We go in, we decide what would be best for this family. We make recommendations, and ultimately it's up to the family to decide what they want to do. Right.
Well, what kinds of things are good for these patients in terms of like quality of life? You know, what kinds of activities or things do you recommend for these patients?
So scientifically, it's been proven that what is good for the heart is good for the brain. So there's basically 5 tenets, and the first is being exercise. Physical exercise helps prevent the development of Alzheimer's or slows the progression of it. It's never too late to start, and kind of think of exercise like a bank account. What you do in your younger years strengthens your cognitive resilience for later in life. But that exercise and getting out is important for people to also keep moving their body and keeping their brain active. The second one is diet, eating a healthy diet with lots of fruits and vegetables, whole grain, lean proteins, and low fat, cutting out sugars and carbs, sodium and alcohol. Again, going back to what's good for the heart is good for the brain. Getting enough sleep. Sleep can definitely help prevent dementia. And what sleep does is it gives the brain and the body time to restore and reboot. And during sleep, your brain stores the memories from the day, and new information, and it gets rid of toxic waste. So your brain does like a deep cleaning at night. It takes all the new information, gets rid of the toxins, and that's why sleep is so critical. Learning new things is important.
Right.
Connecting socially is a big one. Social interaction with other people and activities that make your brain work give an added benefit.
Yeah.
And the last one is managing stress. Anxiety, stress, and depression can cause memory and concentration problems. And managing stress through mindfulness and meditation can be really helpful.
We've gotten a lot of brain information in this episode. We heard about a mini stroke, or a transient ischemic attack, as it's called. We've heard about Alzheimer's disease and dementia. We talked to Jeff Probst, who had temporary amnesia. And what I think we probably all want to know now is, what can we do to keep our brains healthy? Is there anything we can do as we age?
There are ways to maintain great brain health and to even help, circumvent and prevent some brain diseases.
This is Dr. Suzie Bash again.
It's important to note that studies show that 1 in 3 cases of Alzheimer's disease worldwide are actually preventable. So Alzheimer's disease can often be inherited genetically or due to other factors that are completely outside of our control, and that happens in many cases. However, there are preventable, or what we call modifiable, risk factors, and those include improved sleep habits, regular exercise, weight control, no smoking, maintaining a normal cholesterol, controlling diabetes, and then, as we discussed earlier, maintaining that active social and mental stimulation. So moderate or high levels of physical exercise help to prevent that brain shrinking or atrophy. And the impact of the exercise, it was actually found to be equivalent to 4 fewer years of brain aging. So even though I don't really love exercise, I am all on board if it can save me 4 years of brain aging.
Yeah.
So it is important to, regularly exercise. And it's also wonderful to know that that keeping our minds active and engaged can help combat cognitive decline as we age, like memory loss. So the goal is really to never stop learning and growing. And this is also actually what makes life interesting.
Yeah.
And then, getting back to what we were also talking about with stroke, a lot of people don't realize this, but 80% of strokes are actually preventable. So certain risk factors are completely out of our control, like a family history of stroke or heart disease, and our age. Age is a risk factor for stroke. So 75% of strokes occur over the age of 65, and that risk doubles every 10 years. However, there are also a large number of modifiable risk factors. And a lot of them are the same as what I mentioned for Alzheimer's, like controlling hypertension, which is high blood pressure. That's actually the leading cause of stroke. Medical management of atrial fibrillation. Atrial fibrillation is sort of a quivering of a heart chamber, and that has a 5-fold risk of a stroke, and that can be treated. Maintaining, again, a normal cholesterol with medication, controlling diabetes, exercising regularly, maintaining good weight control, not smoking. Smoking has a 2-fold increased risk of stroke. And then minimizing alcohol and, abstaining from cocaine use. And then, as always, if you have any questions at all about, brain health or what you can do, never hesitate to ask your doctor.
On the next episode of Your Body, it's part 2 of Your Amazing Brain. Dr. Bash will be back with more mind-blowing information, along with some other really interesting guests. Nate Mendel from the Foo Fighters is going to talk to us about something he experienced, and we're going to get to that big question I have about the brain. Just how resilient is it? Thanks for listening. If you want to learn more about this HealthCast or some of our guests, please visit www.yourbodyshow.com. And if you'd like more information about RadNet, check out www.radnet.com. Your Body is produced by Steve Kramer, Doug Smith, and me, Stephanie Landon. Technical and research assistance provided by Joseph Wilson. Executive produced by Paul Colacchio and Karen Morad, all on behalf of RadNet. Original theme music by Mark Lakeyear. We hope you've enjoyed our HealthCast. Find us wherever you download podcasts.